Coronavirus has had an enormous effect personally, professionally, and everything for all of us at DISC.
Since the onset of this at DISC, we've not been able to document a single case transmitted in DISC. Why? Because we're very careful with who's in and out the door. We're testing them that day or the day before, so we know we've got them in a negative window.
So to prevent the spread of coronavirus, DISC has always followed the Centers for Disease Control guidelines. We clean all high-touch surfaces multiple times per day. There's universal masking, so all of us wear masks, and we ask everybody that comes into the office to wear masks to help prevent the spread. We stagger the patient time so that there's not congregating or patients arriving at the same time. Our staff is tested frequently every couple of weeks for coronavirus.
We've made a lot of adjustments to allow us to provide the excellent care still. So we're testing providers, testing the staff, we're testing all of our patients. We're making sure that everybody comes in and comes out of this facility COVID-free.
We've had a high filtration, UV treated, high exhausted whole area. We're creating air every minute that's safer than outdoors. Following protocols, people wearing masks, high touch cleaning surfaces, air handling, limiting contacts, they've resulted in a zero transmission where we're actually safer than going to the grocery store.
DISC has always had very robust policies in place to prevent the spread of germs in general. So it wasn't that hard to implement just a couple extra layers to prevent the spread of coronavirus.
When the guidelines came out to do this and this and that, we were sort of like, okay, well, we already do this, this, and that. And then it became a matter of, well, what else can we do on top of that to really make sure that things are minimized? And so we were following the newest data in terms of medical treatment for COVID. And so it's just like if you're gonna run a marathon and you've been running 22 miles a day, you're gonna be a lot better prepared than someone who doesn't run at all. And so I think we've kind of got ready for this fight years in advance.